response has been amazing on Baby Chakra. So, Ask Me Anything is not only about any questions in related to pregnancy and nutrition, but any queries in relation to your child, in relation to what you want to know about your skin, about your health, overall wellness. We are here to ask you only on the platform of Baby Chakra. It is super amazing and exciting to know that we get these so many queries on an everyday basis, and it becomes really, you know, understanding that our viewership has been increasing on many folds. These live sessions are just conducted for you to help you explore with the fact that, a doctor is present in the need in the hour that you require, and your queries will be answered and will be taken up in the form of question answer session. To begin with, let us start with our first question for the day. Okay, so I was reading this article. This was about pregnancy and understanding about how pregnancy needs can be taken care of. And I came across a user's query, which said that I am around 37 weeks pregnant. I am nearing my delivery, but I really don't know what should I do when I am in this last week of pregnancy. I have spoken to my doctor. I am very worried, but still, I have a fear in my mind. Well, this is a very genuine and a very nice query that the user has asked. And what we have to understand is that 37th week, where your delivery is almost nearing to completion, but there could be one or two factors understanding that, pregnancy can be safe and you can still pull on for a longer time. Yes, pregnancy can go beyond 37 weeks. It could last up to 41 and 42 weeks. That is very natural. And when the doctor tells you that you have to do a scan, you have to do this kind of a checkup, you please come visit me, you keep a check on the baby movements. These are very important things that your doctor really tells you to do. Second thing you have to understand is the bag packing. You should be ready with your hospital bag. You should be keeping things ready with you. In short, that if there is a kind of an emergency or overnight you have to get yourself admitted to the hospital, the doctor tells you, no, I have to operate you. You should not be in a rush. So keep things ready. Now, fear is something which we can control, and we can have happy thoughts. We are always waiting for this baby to come. We are waiting how the baby would look, what features would he or she have. We want to hold the bundle of joy in our hands, but we also have to understand that our excitement should be content in a way that we patiently handle ourselves, keep taking the medications till the last date, keep ourselves hydrated, give a check on our routine, which is going to happen in the next few days, so that it becomes very easy for us to have the last minute, hustle free delivery. So I guess the user must have understood that last 30 from 37th week onwards, we have to be careful about the baby movements. We have to ensure that we are in touch with the doctor. There is a lot of back pain which is happening, abdominal pain, because the uterus has grown, and it so happens that there is not enough space for the baby to move. So the baby would be moving in a very different manner. Be very watchful of your movements, and these things will definitely help you for an understanding that your baby is ready to come out for a safe delivery. Our second question from the user has just been spoken, that I have delivered on the last 27 days, and my baby is not gaining enough weight. I am a little worried. Well, the mom, congratulations. First of all, you have to be very happy that you have brought this child in this world in a very safe manner, whatever the mode of delivery may be. But ensuring that you are giving good protection, good, care to the baby, it is very important that you do a lot of breastfeeding to him, do a lot of skin to skin contact, hold the baby to your chest, feed the baby on demand. Do not be worried about what is going to happen, how it is going to adjust, and how the feeding routine would be, and things like that. It is very beneficial for you to understand that baby is in safe hands, feeding is adequate, feeding is through both the breasts at the same time, and feeding quantity is equally important. You start with 5 to 10 ml, and at the end of around 27th week or 27th day, or after a month, you end up around 60 to 80 ml per feed. So, in this slow way, the process of milk quantity increases. You are burping the baby, and also you're taking care, excuse me, you're taking care in such a way that you're keeping the baby on light clothes. You're not wrapping him up in other thermals and other warm clothes, because the baby might have had sweating or might have had dehydration because summers have started. And we have to keep the baby well fed, because the baby is completely dependent upon us for hydration during summers. So that is one thing which is very important for you to understand, and it is very very beneficial that you follow these steps very very meticulously. Now, the third question from our users, we have this, is that in this part of it, we have, I am traveling with my kid in the summers. Okay, my kid is 2 years old, and I don't know. This is the first time he's traveling. I don't know what should I do. What care should I take? Well, this is a very nice question, because probably your kid must have born during the COVID time. So you might have a little, you might be a little scared of how the reaction would be of the child, the excitement on the child when the child is traveling by any means of transport that you're taking in. Well, definitely the first hygienic condition is that we carry a mask, we wear sanitizers, we carry some toys with which are favorite to the child. Also, ensure you carry a lot of dry stuff. Maybe your destination is near, or maybe it is far, but you have to have a backup in your bag, that during your travel you carry some light snacks and also some favorite drink of the child, which will ensure that the child does not have any problems. Now, since you're traveling for the first time, you may not experience the child is having some sickness, that is travel sickness. It could be, vomit, it could be a nausea, it could be just throwing out. You never know, because the child is too small to give away those symptoms. Keep things handy in first aid. Okay, keep the medications. Ask the doctor that this is the first time I'm traveling, and I just prescribe these medications, and the doctor will also prescribe the dosage in what quantity has you are going to take. So this is a first aid small kit which you generally take it up, and definitely it is going to be very helpful for you to understand on how this is going to work, right? So these are the tips and tricks to make your traveling a very safe experience, and definitely it is going to be a most hilarious and an unforgettable experience, because I believe that every child is very special and we treat them more special in a very different way. So yes, all the best, and I think you will do very well. The next question by the user is that I am having placenta previa, and I'm wondering whether it am I going to have a normal delivery. So in this case, we understand that placenta previa is a condition where the placenta blocks the cervix. Okay, and in which week you are is not mentioned. So definitely the placenta keeps rotating in the uterus around the child, around the womb. Okay, and it becomes a little difficult for the doctor to really give a stand on normal delivery. The doctor keeps telling you wait and watch, for the fact that things become very very clear in every scan that you do it with the doctor. So once the stand is clear with the doctor, the placenta has moved. At that point of time, during the 30 from the 34th week to the 37th week or the 38th week, you can discuss it with the doctor, and they will definitely rule out the possibility whether it is going to be a C-section or whether it is going to be a normal delivery. But if it is detected in the early stages of pregnancy, which is around the fifth month or the 6 months, mothers really get tensed. And what I believe is, this should not affect your overall health or your overall routine, because this is something which is not in your hands. The only thing which you can work much better towards it is that you can follow a good routine of exercise, a good routine of sleep, a good routine habit of eating healthy food, and also, last but not the least, a good routine of having your regular checkups, your prenatal visits to the doctor, because these are most beneficial factors which play an important role in helping you understand how your pregnancy is progressing. So I think the user is definitely benefited with this question, and we are moving on to the next question. Okay, I am diabetic and I have a craving for a lot of sugars, and I am unable to control my sweet cravings. What should I do? Well, first of all, congratulations that you are expecting, but I may cautious you over here that diabetes is something which may, if the sugar levels are not under control, then it may affect the birth of the child. Well, there are studies which have really given out a good research stating that high sugars may cause a complication during pregnancy. But if you are not able to control on your cravings, then that is something which is really, you have to seek a help of a dietitian. A dietitian is a person who helps you with these queries and questions, and then she definitely help you with the fact that what to eat in what quantity, what are the other options which are workable for you. High protein diet is given because at a given point of time, as your body is growing, the demand for calories is more, your hunger time is also more. You are constantly feeling like you want to have something. So at this point of time, I would just like to tell you is that when we have our food, we need to have it very very meticulously. We need to understand that we eat in a very quantized proportion. We cut down on simple sugars like rice. We can cut down on sweets, we can cut down on processed products, and this is how it is going to be very helpful for you to keep your sugars under control. And a little bit of exercise which you are comfortable with, whether it is a yoga which you are doing it with under a, under the practice with a yoga therapist, or you are doing walking, you are having somebody, you are always hydrated, you're carrying a bottle of water wherever you're going, and last but not the least, you're having a good sleep. So these are the four important factors for your sugars to be in control. I hope these tips are really, really helpful for you. And because these are something which is very doable, you can keep it in mind and keep it definitely in place. Our next question from the user that is coming up is that my baby is small. He's around 6 months of age, and I I am looking for something which is working in his favor for eating habits. What do I start? Well, to answer this question, we have a lovely session today, which is going to be between 1 to 1:30 on the Baby Chakra app. Okay, we are going to talk about how do I introduce complementary feeding. But before that, I would just like to tell you that after the age of 6 months, the demand for breastfeeding decreases a little bit. There is a guideline by the WHO that we should start introducing complementary foods. Now, what is complementary foods? These are outside food products. This is normal water also, which we start introducing to the child, because the child has a liking towards the different tastes, liking towards the different aspects, and liking towards the different things which they have developed over a period of time. So whenever you are having your meals, you might have noticed your child has started looking for, some signs of, like, removing his tongue, raising an eyebrow, looking at the spoon in the direction that is going to your mouth. So these are the few indications that your child is ready. One thing. Second is, when you're giving the child any kind of a food, you have to give it in a very small quantity. It could be a drop, it could be a spoon, and then later you can increase the frequency of the feeding. Third thing we have to understand is that, one thing, suppose you're giving dal water, which is digestible, moong dal water or rice kanji, these are easily digestible foods by the child. So when we are giving this, we are in an understanding that it will be accepted. Okay, it might be accepted, so the child takes it in, after which we see that when the child takes it in, the child is going to like it in a very nice way, and the child will ask for more. He might hold your hand, he might just remove the spoon. So these are the indications that the child has started liking the foods that you have introduced. Last but not the least, give it in a repeat the same action, so that the child understands what is the food that you're giving. And it becomes very beneficial for you also to understand that things may work a certain day, things may not work a certain day. So don't be stressed that he's eating this, but he's not eating that. Do not get into a judgmental phase, because this all works with trial and error. And I know you beautiful moms are doing an amazing job in helping your babies to understand the different kinds of food, the different textures of food, the different essence of food. So, when we are doing complementary feeding, we have to understand that we are not really forcing the child. We have to be very, very patient. We have to understand that this is a very small step which makes it into a bigger step. Okay, and this is how we have to build upon. So, we now move on to the next question. We have to understand that when you are pregnant, there are many things which everyone may not experience. Okay, second thing is that some of the features or some of the factors could be due to growth or hormones, or could be due to other factors like lack of sleep, lack of rest. So all these things should not be a worry problem for you. Now, I have a question saying that I have had too much of headache and it is unbearable. And one of the users is saying that I am having too much of leg cramping and I am an unbearable pain. So these are two different examples of pain. One is a headache and one is a leg pain. Now, let me get this very clear that, pain could be a part of your journey. Understanding that if your routine has been very hectic, it has been very stressful, it has been very hard for you, it might happen that, the child, there would be some strain on your body. So, during summers, you have to understand that you have to be very, very good hydrated. Hydrated matlab, you need to drink a lot of water. Keep drinking other liquids like buttermilk, like, coconut water, like lemon water. And this is going to be helpful for you to understand that these all symptoms are going to reduce reduce for the fact that things will be in a much better position. Now, when you are going in a routine, okay, these things have to be accepted by the body. Why? Because you have to understand that for the complete 9 months, these are going to be a part of your life. So understand that pain would be there, a little discomfort would be coming in. Otherwise, how would you enjoy the journey of pregnancy? That is the thing we have to understand, that we as mothers to be, experience a mixed baggage of emotion, and it becomes very, very good for us that we get used to all these things in a better way. Second thing, last question for today is that I am 4 months pregnant and I am having a difficulty in passage of stools. There was little blood that I noticed, and now I'm very scared. Well, the mom to be, first of all, relax. This could be a pressure on your uterus, and that is why there would be a little bleeding, or this could be lack of fiber in your diet. Now, what is fiber? Fiber is something which makes our digestion very easy. Where do we get it? We get it in green leafy vegetables, we get it in oats, we get it in, our cereals. And there are two types of fiber, soluble and insoluble. Soluble ones we get it from the, cereals, and insoluble ones we get it from the fruits. So, fruits and vegetables play a very important role in the part of fiber. So that is the reason, if you have cut down on your cereals, if you have reduced the portion of quantity because you're not able to eat because of summer, you're just having fruits. Okay, somewhere something is missing. Like, you're not drinking too much of water, you're not keeping yourself hydrated, you're not having other things, and it could be because of less fiber in your diet. So relax. Think about what you have eaten. Avoid spicy and oily food, and definitely your constipation problem will be relieved, and you will have an easy passage of stools. Okay. Pregnancy makes our body a little difficult in understanding that we are having experiencing these equations, and we need to have a clear understanding of how this can be worked. Okay, so I have taken enough questions. If you have any, please write down to me or Baby Chakra. I am there to answer your questions, and I will be taking it up tomorrow at the same time at 10:30. See you. And if you have any queries, or if you have liked the way I have answered, please review me on the Baby Chakra app. Thank you for coming with me live on Ask Me Anything. I will be available from Monday to Friday at 10:30 to 11. And also, we will be coming up with different various topics of live chats of, interesting topics. Stay tuned on the Baby Chakra app. Thank you. Have a good day.